Hello everyone, in this video we'll have a quick review of apoptosis and necroptosis. So now let's talk about what is apoptosis. It is basically a programmed cell death. Various pathways are intrinsic pathway, which is the mitochondrial pathway, then the extrinsic pathway, then third is the perforin granzyme dependent killing. First let us talk about what is basically happening in a normal cell. Normal cell receives a survival signal like growth factors, which leads to production of anti-apoptotic factors or proteins, and these keep in check that there is no leakage of cytochrome C from the mitochondria, so cell death do not occur. Now let's talk about the intrinsic or mitochondrial pathway. First note, in exon 5 is the marker for apoptosis. It is an MCQ question. Now in intrinsic pathway we have anti-apoptotic factors like BCL2, BCLXL and MCL1. And we have pro-apoptotic factors like BAX and BAC and sensors like BAM, BID, PUMA, NOXA. They are also known as BH3 only proteins. They regulate the balance between the two groups. Now what happens is when cells are deprived of the survival signals like growth factor or there is DNA damage, the sensors will sense the stress and they'll activate the pro-apoptotic factors BAX and BAC, and this will lead to leakage of cytochrome C from the mitochondria. And when this cytochrome C comes to the cytoplasm, it binds to a protein called apoptosis activating factor 1, which forms like a wheel-like hexamer, and that is known as apoptosome. They activate the caspase 9, which sets up an auto amplification process and leads to apoptosis. Now let's talk about the extrinsic or death receptor initiated pathway. They basically belongs to the TNF receptor family. We have FAS, the ligand which is also known as CD95, and when its ligand binds to the FAS, then FAS associated death domain is activated, which further activates the caspase 8 and they activates the executioner caspases and it leads to apoptosis. There is one question like caspase 8 is inhibited by FLIP. Now let's talk about caspases. They are initiator caspases and the executioner caspases. Initiator caspases in intrinsic pathway is the caspase 9. In extrinsic it is 8 and 10. And executioner caspases are 3, 6 and 7. They are common to both the pathways. Now let's talk about necroptosis. Basically it is an programmed necrosis, a hybrid of necrosis and apoptosis. It is active process. What happens is it starts similar to the extrinsic pathway of apoptosis, like tumor necrosis factor combines with its receptor and it forms a necrosome. Necrosome consists of receptor associated kinase 1 and 3 and caspase 8. What happens is that caspase 8 is not activated, so it leads to decrease in ATP, increase in free radical formation, DNA damage occurs and membrane damage occurs similar to necrosis. So morphologically it is similar to necrosis.